that approximately 80 million people in the U.S., they suffer from some sort of vein disease, but you don't have to live with it. And that's where Goodman Vein and Laser Center are here to help. Here to tell you about the treatment is the man himself, vascular specialist, Dr. Robert Goodman, Goodman Vein and Laser Center. Good to have you here. Let's talk about you first. How'd you come to this? What are your qualifications that allow you to practice in such a way?
Well, I'm a vascular surgeon. I did a special fellowship at the Bay State Medical Center after I did my general surgery residency. And I also have been practicing vascular surgery, blood vessel surgery in the area since 1983. Part of my training in 1981, I went to London and worked at Guy's Hospital at a vein center. And so I've actually been practicing vein surgery since the 1980s. I take it very seriously. And as my practice has evolved, I have specialized more and more in just doing vein surgery as compared to the other aspects of vascular surgery.
So this seems to me to make you kind of an expert here, and I don't know about other people's qualifications in the Valley, but it seems like maybe you've been doing it for a while.
Well, again, I've been doing it since the 1980s. I take it very seriously. I belong to a number of national and international organizations that promote vein surgery and vein treatments. I'm actually the only member of the American Venous Forum and the American College of Phlebology in Western New England. And I also belong to the Society of Vascular Surgery and the New England Society of Vascular Surgery. All of these are invitation-only organizations. And so
you're a man who knows veins.
I take it very seriously. It's a very important.
Well, and it's vital too, not only to general health but appearance. And I think a lot of people need help with it for both of those reasons.
Well, actually, that's the mistake that people have about vein disease, is they think it's all cosmetic. In fact, 90% of our patients are there because they have symptoms and that their vein disease is actually affecting their daily activities and making it hard for them to work and to take care of their children.
So you're really performing a vital service in the community. Now let's talk a little bit about your practice. People know you now. Let's talk about your practice.
Well, we've been a dedicated vein center for at least 10 years. It's all I do. I don't do other aspects of vascular surgery anymore. I don't do lumps and bumps. We've dedicated ourselves 100% to vein disease. Because of that, we're able to offer in-depth, broad treatments for vein disease, both on the medical side of it or the symptomatic side of it, and somewhat on the cosmetic side as well.
Now we're looking at some varicose veins right now, as you can see on the monitor, and those are just one of the types of veins that you help to eradicate. There's also spider veins too, is that right? Right.
It's all a same process. It's just that the varicose veins are the more advanced aspect of this in the setting of the vein disease, and in treating one, you actually are treating the other. If patients come in with varicose veins like this and we treat that, actually some of the spider veins will get better also. If they have spider veins and they have underlying vein problems, that has to be addressed or any spider vein treatment won't work in the long term. So we try to look at the whole spectrum and make sure that we understand why do they have the varicose veins, why do they have the spider veins, and we try to treat the root cause before we treat what you see.
Now, Dr. Goodman, I have a somewhat weird analogy for you. Anyone can open a restaurant as long as you have the most basic skills. Is that similar for vein surgeons? What do you need to call yourself a vein surgeon? And I can only imagine that you have so much more skill than anyone who can just open up a practice.
Well, that's actually one of the things that our societies are addressing. As I said before, I belong to a number of national organizations, and in fact, anybody can open a vein center. And we're trying to police that. We're trying to get it more regulated, more standardized. The national organizations I belong to, the American Venous Forum, the American College of Phlebology, we have national seminars, we have education programs. If you're going to do vein surgery, we try to make sure you're doing it right.
So there's ways that you can stay on the top of your game. And it's imperative that people do that. Now, if someone is maybe thinking about coming to your practice, what are symptoms that they might be seeing on their body that would indicate to them, I need to go see Dr. Goodman?
Well, most patients, their legs are tired, they're heavy, they're achy. They can't figure out why, they can't get comfortable. They come home from work or a long day, and the first thing they do is sit down and put their feet up in the air because that's the only thing that makes them feel better. The restless leg syndrome at night, they can't get comfortable. Leg swelling, ankle swelling, tightness. In the end stage, people can get ulcers. That's end stage disease. And then also just the appearance. They say that they're tired of looking at this stuff.
And it's always better to act sooner rather than later, so people can give you a ring and get a consultation whenever they want. Thank you so much for spreading this message. Unfortunately, we're out of time, but if you want a consultation, you can call Goodman Vein and Laser Center. This gentleman right here, 413-781-1576, or just visit goodmanvein.com for more information.